I'm giving you guys a chance to get on. Please get on, get on, get on, get on. I appreciate you guys taking time out of your busy schedule to get on tonight. So please come on and get on. It's Medical Monday time. Yes, it is September the 10th. Wow, September the 10th already. We're at the end of the summer, beginning of fall. Fall is one of my favorite times of the year. I love apple orchards. Yes, I do. So I was just talking about that today with the briskness in the air. To me, it is cold. Yes, it's cold. Hey, Miss Mazine Robinson, thank you for coming on. Please like, invite, and share as you come on. Hey, Romeo79 joining in. I appreciate you. I just want to say hello, 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 hello. Hey, I'm waving at you. I'm sorry, and I'm blocking my other screens. Thank you for coming on. Please like, invite, and share as you guys coming on. I am streaming live, Facebook Live, Instagram, and YouTube. Trying to save some work, right? It is Medical Monday. I am Dr. Grace Patterson, affectionately known as Dr. Grace. Yes, I am a medical doctor in the Metro Detroit area. I am a native Detroiter. Yes, I am. I've done all of my education here in Detroit. Yes, I am. For those of you who are on the northwest side, I went, let me tell you about my little education. I went to Quarry Elementary School, and they walked us 11 blocks to Cook Elementary. They didn't bus us, they walked us. I had a shorter walk to Quarry, but they was like, we're going to walk you to Cook. So I went to Cook Elementary School in Rosedale Park, which is now a historical area in the Metro Detroit area. Then I went to Serving Middle School, and I went to Cass Tech for a semester, and then I went to Renaissance that January, and then I was a teen mom, had my daughter, which her birthday will be tomorrow. Tanisa, blessed birthday to you. I am so glad that you were born, and I'm so glad that the Lord saw fit to choose you for me to be your mom. And so her birthday will be tomorrow, 9/11. Yes, yes, yes. But anyway, I had to go to Redford because Renaissance High School was considered an accelerated college prep school with rotating courses. So I had to sit out for a year, and I went to Redford High School, which is now the um, Myers store that is on Finkel and Grand River in Detroit. And then I went back to Renaissance High School. I graduated in time in 1985, and then from there I went to Mercy College on Grand, which was on Auto Drive in Southfield, which now is part of, which is WC3 now. And then now Mercy College of Detroit. Mercy College is now combined with U of D Mercy, which is now U of D, and it became what is it now called? Mercy, U of D Mercy. That's what it's called now. Anyway, I just wanted to let you guys know that I am a native Detroiter. I've done all my education here. Went to medical school. It took me a little longer because I was a single mom, and to God be the glory. I was able to go to medical school, do residency, had a myriad of positions, and now I am working for myself full time, 100%. I have contracts here and there, but I work for myself, and thank God for that. To Him be the glory. But anyway, and so I do Medical Monday, which was birthed out of Great Faith Ministries International. We used to do Medical Moment during our service times. We used to do video announcements. So the Lord put it on my spirit, hey, you need to do Medical Monday, educate the people. The best healthy person is an educated person. So what I do, hey, Pastor Debbie, thank you for joining on. Please like, invite, and share. I think that is what is that? Saying CAD W. That's all I can see on the Instagram. Thank you guys for coming on. Hey, Tawana, thank you for joining on. Please like, invite, and share as you guys come on. The topic of tonight is, what are you waiting for? Hey, Pastor Drill, thank you for joining on. Please like, invite, and share as you guys come on. My question is, what are you guys waiting on? I have been on Medical Monday consistently now for 2 years, and some of you under the sound of my voice have been doing very, very well in your health maintenance and your health mapping and all of that. But my question is, what else are you waiting for? I've had, when I've been doing this bedtime belly buster bundle, is which some products you take the 30 minutes to an hour before you go to sleep, and we've been having a phenomenal response. So for those of you who have not gotten yours, what are you waiting for? I want to know, what are you actually waiting on? I mean, I had this one young lady who has been on here every Monday, decided that she was going to get it, and she texted and messaged me and like, oh my God, I just took it the first night and I feel amazing. She was like, I slept like a baby. So please, please, I admonish you to put yourself first. You know, we always talk, men and women, especially those of you that are in ministry. We always put people before us, before ourselves, but you need to be in optimal good health in order for you to carry out the plan and purpose God has for your life. So this, I'm telling you, the bedtime belly buster is phenomenal. I just thank God for it. That is something that I use. I have been seeing a release in weight for sure. I've been seeing a difference in my skin for sure. I've been seeing a difference in my energy levels for sure. My my clothes are fitting more loose than ever before. I have noticed since I've been doing the bedtime belly buster consistently. Let me say that again. Consistently, I have been releasing even more weight, and I'm gonna be honest with you, I haven't been going to the gym as much, and I have been seeing an increase in me losing and releasing those pounds, and I'm doing it while I'm sleeping. So the question is, what are you waiting for? You know, we always want an easy fix, and we want something that's done quickly. This is it, the bedtime belly buster bundle. If you're trying to get rid of that tummy, if you're trying to get rid of those hips, you're trying to get down so you can feel better and be healthy, the bedtime belly buster is for you. So my question is to you, what are you waiting for? I want to say, hey Doris, thank you. Doris, thank you for coming on. Please like, invite, and share with your friends and family as you come on. And I was just talking about how we have been getting a overwhelming response into the product, the Bedtime Belly Buster, and how it has been helping so many. So you need to get on board and get yours. What I've noticed in regards, hey Maria, thank you, Maria Linda Manry, thank you. Please like, invite, and share as you come on. I want you to invest in yourself. Remember, I said I'm not asking you to spend money that you don't have. I'm not asking you to spend extra money. I'm asking you to redirect those dollars that you know that you're spending on things that are not conducive to your overall benefit and good health. Just redirect those dollars. Hey, Jacqueline Nellums, thank you for coming on. Redirect those dollars. Please get this Bedtime Belly Buster bundle, please. I've been seeing a difference, like I said, in my skin, my sleeping, my energy, releasing the weight. You really, really need to get this product. The topic of this discussion is now, what are you waiting for? You know, there's a scripture that talks about, it's kind of like a parable or story. If a person looks at the weather, they would never sow, and they would never benefit from a harvest because they're waiting for certain type of conditions. You do not want to wait for something to happen to you for you to try to do better in regards to your health. Not saying that you can have a turnaround, not saying that you cannot have a recovery, but there is this old saying that a pound, what do they say, an ounce of prevention is better than a pound of cure. So when I get on here every Monday, except for those times that I do take off, and share this information with you, I want you to become active. I want you to become proactive in doing what you need to do for you to be the best you that you can be, so you can do what you need to do. You need to be purposeful in every area of your life. Um, I know sometimes we can do things out of, I heard someone say, passionate about something, but passion is not going to sustain you. Your purpose is. And part of your purpose is for you to be in the best health that you can be, so you can carry out what God has called you to do, whatever that is. Being most of us have multiple multiple labels, multiple tasks, multiple hats that we do, and it's not just women, it's men too. You have men that are pastors, that are husbands, that are fathers. They may have more than not only work and labor in the ministry, but also have a circular job. So it is very, very important that you do what you need to do to maintain your health. You have to do it. There's no way around it. You got to do it. And since I've been doing the bedtime belly buster, I have also seen a change in my desires for foods. I don't have those cravings for things that I should not have, because let's talk about this. One of the things that I did a video on, or a Medical Monday on, the proper way to sleep. And part of the bedtime belly buster helps you, has a sleep aid, a natural sleep aid, which is melatonin, that helps you sleep at night. So if you're sleeping well and getting the rest that you need, remember, the less you sleep, the more you eat. So if you're getting the sleep that you need, you're not going to be hungry, you're not going to be famished, you're not going to be craving those things that you do not want, because the less you sleep, the more you eat, you have cravings, and then you're not able to suppress those stress hormones that make you, number one, gain belly fat in the first place, the cortisol. And cortisol, when it's released, because God has not created us to be in a stressful state all the time. So when a person can be in a stressful state all the time, then those cortisol levels are up. Not only do you have belly fat, it causes thinning of the hair, it causes nervous problems, it causes concentration problems, it causes people to gain weight because they are craving those sugars and things that they should not. So I highly recommend you. There is also a link that I have posted on my personal page and my business page. There's this thing that's called the Bedtime Belly Buster Bundle, or Belly Buster for Dummies. It's a free ebook. Please download it and read it. And then not only read it, get the products that go along with it that I recommend it for, recommend that you do, because you are worth it. There's no way that we can get another you. So I am Dr. Grace Patterson. I am managing owner of Bethesda Holistic Center and Everything New. We have a lot of projects that are coming up. I have been looking at you guys inboxing me, saying some topics that you want me to revisit. Somebody wants me to talk about heart disease, hypertension, and I think diabetes is one that I saw. So after tonight, we're going to revisit some of those things and redo some of those things, because this is what I tell people. If you're reading books, or going to the library and reading books about health, textbooks or anything like that, especially you providers that are out there under the sound of my voice, other doctors, physician assistants, nurse practitioners, nurses, of course, medicine is always forever changing all the time. The only thing that is not, if I can be honest with you, the only thing that is really not changing that much is the alternative and natural medicine. Hey, Kathleen, thank you for sharing. Getting on, please like, invite, and share. You said that's the answer I need already. Oh, really? Well, that's good. Um, what we want to let you know is that most alternative and natural medicines are based upon biochemistry. Biochemistry always stays the same, is consistent, and the human body and the way God created and function, and way God created to function and design for you to prosper and to be good health as your soul prosper. Um, that is consistent. Facts change, but the truth always remains. So, how God created us and how He designed us, more homeopathic, naturopath, alternative modalities are consistent in how we were created and how we were made. So, one of the things that I talk about most often is hydration. We talked about that all the time, every show. I have to talk about it because hydration is very, very key, because you need to be hydrated. We're also are going into a change of season. Now is the time for you to consider doing a detox. Now is the time for you to get your place, clean out the old stuff from the summer, but also to get your body ready for the change in environment. So when you have a change in environment, that means weather, climate change, your house, that things temperature wise, your body has to adjust to that new environment change and exposure to those environmental changes, be it the temperature, be it to pathogens, allergens. Pathogens are viruses and bacteria and things of that nature. And your immune system needs to be built up and prepared for that change. So how do we do that? You really want to know how you get prepared for the weather change? We do have some products that one is called Immune Boost that you can, it's a powder form. Then there's also something that's called Immune Zinc. And all these things help you to build up your immune system. So let's talk about the immune system, the immunity or immune harmony, that as I call it, to get you prepared for that. What I need you to do, what I'm going to also offer, is what we call an ebook in regards to building up your immunity, because it's very, very important that you, during this change of season, educate yourself and invest in yourself to prevent yourself from being exposed to every year the flu virus, the flu bug. Hey, Kim Cole, thank you for joining on. Please like, invite, and share. The flu bug. Should I get the flu vaccine? Should I not get the flu vaccine? What can you do to build up your immune system? So after tonight, I'm going to post a link within the next week or two, because I'm still writing it. Hey Jay, are you still here in the Metro Detroit area? We've been trying to get in touch with you. I heard you extended your stay. Jay is, I think you are relocated to North Carolina, and Jay is interested in receiving services from our facility, and I consider it a privilege and an honor, sir. So reach out to us and figure out what we can do, or are you on your way back? I don't know, but we were trying to make it happen. So thank you so much for reaching out to us, so we can provide you with the services that you so deserve in order for you to maintain your health. Thank you for that. Please like, invite, and share as you guys come on. So, but anyway, you really need to invest in yourself. You know, like I tell people, and I say this often on Medical Monday. You know, people have car maintenance. You know, they go get their hair done, nails done. You know, everything that's on the outside, but you really need to maintain things on the inside. From a general perspective, as a medical doctor, we're taught generalities based upon sex, based upon being sex, mean male and female, based upon your age, person's age or youthfulness, as I say, or based upon your past medical history and past family history, what predisposes you to a person to certain things due to what is in their bloodline. So, what I would like to encourage you to do, even those are generalities based upon those things that I described, and ethnicity, your person's race, you need to do something on a personal level. Hey, Catherine McQueen, thank you for joining on. Please like, invite, and share as you come on. You need to do something on a personal level. We at Bethesda Holistic Center are known for health mapping, which allows us to tell you where you are health wise right now and create a step by step plan to get you where you want to be health wise, step by step. Which is very, very key and very, very needed. You know, example, go to a doctor, they take a history, you give them, if it's outside of your maintenance plan or your history and physical for the year, or your physical for the year, or physical every 2 to 3 years, depending on what your age is or whatever the case may be. If a person has high blood pressure, then there is things that we prescribe for that person to maintain that blood pressure, along with education. Education is very, very key. I myself, there are certain screening criteria that I do from an alternative perspective before I write a script, because I treat you as a whole person. Why is your blood pressure high? I also look at hypertension. I'm getting into my hypertension topic a little ahead of myself, but just give you a little tidbit, a little tease, that hypertension is, in my book and my studies from an alternative perspective, is an autoimmune anti-inflammatory disease, more so than something that has a genetic predisposition, and caused by vasoconstriction and high cholesterol levels. It's more to it than that. And all those things need to be addressed. Even how you handle situations, how you handle your thinking and your thoughts and your perceptions of situation and people also play a role in hypertension. So I do a holistic approach, not holistic approach or with an H, holistic approach, which is, hey Susan, thank you for joining on. Please like, invite, and share as you come in. A holistic approach, meaning whole, WHOLESTIC, holistic approach, because you are a triune being, spirit, soul, and body, and all those areas need to be addressed. Hey, Miss Mazine, thank you for joining on. Please like, invite, and share. So if there is always some type of drama going on in your life, it affects everything. So you have to make, we all have to make hard choices in regards to how we want to live our lives and health. So if there are people, things, places, events that are always causing some type of ruckus in our lives, taking us away from our maintenance, our base, which is our peace, we need to make some hard choices in regards to what we need, who needs to be in our life, and who should not be in our lives. Hey Dion, thank you for joining in. Please like, invite, and share as you come on. And not only people, but people that are assigned to us, as far as helping us with our health. Every time you go see your physician or your doctor or practitioner, whomever it may be, are they just writing scripts after script? And maybe some people have what I call compounded complex cases that sees a myriad of different providers, be it primary care doctor, maybe a cardiologist, maybe a nephrologist, which is a kidney doctor, or maybe a rheumatologist over here, and all of them are writing scripts, but no one is really sitting down and going through the medications. I really take my time and go through the medications, because for every pharmaceutical drug you take depletes the body of something. Let me say that again. For every pharmaceutical medication that you take deplete the body of something. And I like to use this as an example. If you take a water pill, be it Lasix or hydrochlorothiazide, it depletes the water, it controls the blood pressure by having a person to go to the bathroom, removing the water from the system, which helps lower the blood pressure. But what happens, that person is depleted of potassium. So if a person is depleted of potassium, what happens? They have muscle constriction or muscle spasms. What causes those muscle spasms? Those electrolytes are off, because potassium is very, very important. When the muscle contracts, it needs to relax. So potassium helps the muscle relax. So if you're someone under the sound of my voice, they're having cramps in your arms, cramps in your stomach, cramps in your legs, you could be potassium depleted. But we need to check your blood to figure out that for sure, and then supplement you with potassium or magnesium, because magnesium is also helpful in relaxing those muscles. That's why I tell people that they need to do Epsom salt baths. Epsom salt is not salt. Hey Marvin, thank you for joining on. Let me tell you this. I had one patient tell me that one doctor told them that due to the fact that they have high blood pressure, that they cannot take an Epsom salt bath because Epsom salt is salt. That is not correct. Epsom salt is a misnomer. They call it salt because it looks like a salt, but really Epsom salt is magnesium sulfate. Magnesium sulfate is magnesium helps the muscles relax, and your blood vessels are lined with muscle. So if your muscles and your blood vessels are relaxed, they open up more, and if they open up more, it decreases the pressure. Now, if you're someone under the sound of my voice and your doctor told you that, please don't be mad at them. They just don't know. So, but I am telling you, it's safe for you if you have a diagnosis of high blood pressure or hypertension. It's okay to take a magnesium sulfate bath. Magnesium is also what we use in pregnant women that have preeclampsia or eclampsia. Magnesium is what we put in their IV to bring down the blood pressure, along with preventing them from going into seizures. Hey, Carl, thank you for joining on. Please like, invite, and share. You never told me if you tried it, that recipe I sent over to you when you had posted that you was ready to eat, and I gave you that recipe. Hopefully you tried it. Hopefully it was good, and hopefully that it was something that you liked. So let me know, Carl. Did that recipe work out for you? It was healthy and nutritious, and not only that, if you did it like I told you to do it, tastes good as well. But anyway, we're talking about what are you waiting for? So all this information that I'm giving you guys, what are you waiting for to act on it? Some of you do, some of you don't. Let me also say this. Hey, Miss Mazine, that's me, the muscle spasms. Yes, you got to also remember that your heart is a muscle. So if your peripheral muscles are spasming, there's a high probability that your heart could be spasming too. And if you're someone that is a diabetic or diabetical, what happens, I'm getting a little bit into my diabetic lecture too, just a little teaser here. Um, Diabetic neuropathy, let's talk about that for a minute. What happens is when with diabetes, hey Bishop, thank you for joining on. Please like, invite, and share as you come on. Diabetes, what happens is when a person eats a meal, the pancreas releases insulin, and the insulin goes out to the cells of the body to land on the receptor and open up the gates to the cells for the sugar to go in, for the cell to utilize the sugar, so your body can take the sugar and go through all the biochemical processes for your body to be nourished. What happens in type 2 diabetes, most oftentimes what they call adult onset, which should be really called, um, um, in my book, should be called adipose or obese diabetes, is that a person has what they call truncal obesity in the gut area, to where when insulin goes out to those cells, there's so much bad fat, or skinny fat. Remember I told you that visceral fat, that bad fat, to where the receptors are covered by the adipose tissue, to where the insulin cannot recognize the receptor to open up those gates for the sugar to go in. So that's why your doctor should be on you tough, tough, tough to release the weight for weight wellness. And not only that, to get your waist size down and get rid of the bad fat. So when your pancreas releases the insulin, that your cells can recognize it, and the sugar can be utilized in the biochemical processes in the body for you to be well nourished and to be healthy. So what happens when that doesn't happen? Your body has all this sugar, and your body is very, very smart. It says, okay, I got all this sugar, and you're not using it. What am I going to use with the turn the sugar into? So your body turns on another biochemical pathway, and it takes that sugar and makes sorbitol. What is sorbitol? Sorbitol is an alcohol, and alcohol burns, right? So you have this alcohol that goes around the nerve endings of the eyes, that goes around the nerve endings of the heart, goes around the kidneys, goes through the nerve endings in the hands and the feet. That's why some diabetics have what they call diabetic peripheral neuropathy, and a stocking glove distribution, where their hands feel numbly, tingly, or burning, or their feet feel numbly, tingly, or burning. And then if a person they call a diabetic has a high probability of having what they call a silent heart attack, because their nerve endings have been pickled by this alcohol. They have a high probability of going blind because the sugar levels are so high. So the body is taking the sorbitol as glucose and changing it to sorbitol, and so it damaged the nerve endings around the eyes. Hey, Larry Smith, thank you for joining on. Please like, invite, and share as you come on. And so that's why it's very, very important, if you're someone under the sound of my voice that's a diabetic, that you have to get your eyes checked. You got to get your EKGs and your echoes to check your heart. You got to make sure that that you get blood levels tested for your kidneys, to make sure your kidneys are functioning, because you don't want to wind up on dialysis. So those are the type of things that I want you to ask yourself. What are you waiting for? If I'm on this show every Monday, Medical Monday, giving you all this information, what are you doing to be proactive, to and be consistent? Not just do something one time and be like, I tried that and it didn't work. No, you need to be consistent. And I know life happens to people. I mean, let's just be honest. Life happens, things happen, and we have to redirect our finances or whatever. But at the same time, don't go cheap when it comes to your health. Prime example. This is a true story. I am not making this up. You cannot make this stuff up. So I have a patient that called the office today. Well, I called the patient because I'm letting them know that I'm going to be seeing them early in the morning, and I know him. I've been seeing him for years now, and he's not an early morning person. So I called him and told him I'll be coming a little bit early. He was like, "You know, I don't get up to such and such a time." I said, "I know. That's why I'm calling you to let you know." But he needs some eye work done. And so Medicare, straight Medicare, those of you under the sound of my voice and that don't know this, Medicare only covers up to 80%. And then the patient, if they don't have a secondary insurance, be it Medicare, Medicaid, or something else, they're responsible for the 20%. So he can't see and having eye problems, and he says that he doesn't want to pay the copay and he doesn't want to pay the 20%. But then at the same time, he's going blind. Please, you are worth every cent, every dollar, every dime. Okay, so whatever you need to do to be the best you that you can be in regards to your vision, in regards to not be winding up on dialysis, whatever the case may be, you need to redirect your dollars to make sure that you get the proper treatment that you need for you to be healthy. Don't go cheap when it comes to you and to your health. Let me tell you this too. Whatever you're going through health wise, you're not going through it by yourself. And you're probably like, well, Dr. Grace, what do you mean by that? When you have people that love you, you have people that care about you. So when they see you not feeling well and not your best, when people love and care about you, it affects them to see you go through that. Okay, so you're not going through it by yourself, number one. Number two, it affects all your relationships, family relationships, it affects business relationships, it affects your how you perform at work if you have a job or if you have contracted work. When you're not your best, it spills over into a lot of things. And for a person to say, and I've heard it, for a person to say, I have to pay for that, yeah, you have to pay for that. Cash, yeah, or insurance. And a lot of people that work for themselves, that are entrepreneurs, some of them don't have insurance, and yes, they have to pay out of pocket. And for some alternative services, you have to pay for it. You do, but you are worth it. You should not be going blind. You should not be sitting in bed that you're riddled in so much pain and that you don't know what's going on with you, to the fact of the matter that you're not willing to redirect your dollars to find out what's going on. So God can use people like me if he does not decide to heal you miraculously or through a miracle, that you need to be proactive and put your, how they say, put your money where your mouth is. You know, you really need to do something in order for you to be the best you that you can be. And by me being on here every Monday night at 8 o'clock to tell you this is what this is what that is, this is what I recommend, and then you just like, oh, I don't have it, or you don't make a plan to have it, because most people under the sound of my voice, not all of you, some of you, you have money for everything else. You have money for that fried fish dinner that you should know you should not be eating with those fries. You have money for that. And then it's not healthy for you. And then you have money for whatever. You have money for uh, things that are not healthy for you. Let me just say that. Smoking. Some people that's going to hear this message, they smoke. Cigarettes are $7.50 a pack, and they're going up. $7.50. Some people are a pack a day smoker. Okay, $7 a day for 365 days a year. That's $2,600 a year. $2,600 a year of damaging the body. So the person is taking $2,600 to smoke something that has a black box warning on the package by the Surgeon General of the United States that say if you partake in this activity of smoking, that person is putting themselves at risk for cancer and a whole bunch of inherited diseases, but they're spending their own money to do that damage to their own body. Okay, so my question to you, what are you waiting on in regards to redirecting that money into, number one, instead of spending it to smoke, spend it on something to help you stop smoking, or spend it on other things. Redirect it. I mean, you have to stop. And I know it's easier said than done for me because I never smoke. And it has been scientifically proven, and it's in literature and in whatever you want to read, that smoking, they put things in it to keep people addicted. So it's not easy. So so you can redirect your dollars from $2,600. That's a lot of money. And I tell this story, which is a true story, when I share this information with those patients of mine that smoke. One year, my daughter, it was my mother, my daughter, and we went on an all-inclusive trip to the Dominican Republic. That was our airfare, our hotel stay, and all our food, and everything was included for $1,900. And I think we stayed maybe 5 days. And that is a fraction of the cost of somebody who smokes a pack of cigarettes a day. So not only are you smoking a vacation. A lot of people say, I don't have any money to take a trip. Yes, you do. You're smoking it. Or I don't have any money for the products that you recommend, Dr. Grace. Yes, you do. You spending it somewhere else. You just need to redirect it. So if you're someone who gets coffee every morning, and especially if you're someone who has a diagnosis of hypertension, why are you drinking coffee? Caffeine in it increases your blood pressure levels. Had a patient that her blood pressure was 3 digits over 3 digits. Okay, and she was like, Dr. Grace, I know why it is, because it was cold today and I wanted some coffee, so I had 2 cups of coffee back to back, and plus didn't take her medicine. Okay, so I said all of that to say we do what we want to do. So I want to know, what are you waiting for? Are you waiting for something worse to happen to you before you say, okay, I'm really going to buckle down and do what I need to do? What are you waiting for? We only get one you. After you, that's it. We can't get another you. So we need you to invest in you, and first of all, making decisions that are best for you. You can't keep on allowing toxic people, toxic situations, toxic whatever to be in your life. You got to have a handle on those thoughts that you have. I did a whole video series on about thinking, and about thoughts, how we have repetitive thoughts that are negative throughout the day, and what are you doing to combat those thoughts? What are you doing? Prayer, meditation, all those things work together for your good, okay? So you got to understand that you need to redirect so many things, not only your monies, but you need to redirect some people in your life. You know, we have caller ID on our cell phones. You know when that certain person is calling you, what is going on with that. I see someone that says something about, that's what I am going through right now, numbness in my feet and my hands. So if you're having numbness in feet and tingling in your hands, we got to make sure what we need to do is control those glucose levels. And the best way to control those glucose levels is by what we put in here in our mouth. Remember, whatever we put in our mouth either adds to our life and take away from our life. And even what we speak out of our mouths also add to our life or take away. So it goes both ways. So you got to make sure that those sugar levels are being regulated, because we can adjust medications, we can adjust insulin doses, we can adjust all that other kind of stuff. But if there is not a solid plan in what we should eat and should we not eat. And stress is one of the stress. We could be eating right, we can be taking our medications, but if we are exposing ourselves or allowing very high stressful situations in our lives, it can affect our health, can affect our blood pressure levels, our insulin levels, our glucose levels. It can just really throw everything off. Like I said, our cortisol levels, all of that. So we have to avoid stress as much as possible. And not only if you avoid stress, manage stress. Management of stress is also your perception on how you think about things. If you think things are bad, guess what? They are. If you think things are always happening to you, guess what? They will. If you always think negative, you always will draw that in your life. So as a man thinketh, so is he. Our weapons are not carnal, but mighty to pulling down strongholds, casting down vain imaginations that exalt themselves against the knowledge of God. And we have to put it under captivity of Christ Jesus. We have to do that. That's our job. So what are you doing to combat those thoughts? So, and the only way that you can combat those thoughts with the Word of God, by spending time in prayer, spending time with God, and spending time in your Word. It's because greater the heat that is in you than he that is in the world. So you have to know that even the not so good stuff, all things are working together for your good. But you have to know that. Not only do you not have to know that, you have to apply it. There's a difference between knowing what's right and doing what's right and applying it to your life. Those are three different things, because the Word of God also tells us to know to do good and not to do good is sin. So if you know what was right and you're not doing it, and if I'm on here Medical Monday telling you what you need to do for your health, which is right, and you're not doing it, then you open the door for sin. What is sin? Sin is the foundation for every sickness, infirmity, and disease. Period. Let's just be honest with that about that. Now, I'm not saying that it's your fault that you may be sick or things may happen to you or whatever the case may be, but there is a high probability. Let's just be clear about that. Wherever you are in your health state today is by decisions that you made yesterday. There's no way that we can say that. And I'm not talking about things that is beyond our control or outside of our control. I'm not talking about that. I'm talking about things that we have control over. Because let me give an example here. It is not your fault that, like say for instance, a person was walking across the street and somebody goes through a red light and they hit a person. I'm not talking about that, and they're paralyzed or whatever the case may be. That is an infirmity, that is an affliction. I am not talking about that. I am talking about ironclad decisions that you make every day that either add to your life or take away from your life, that you have control over yourself. Like, let's just start what I always talk about on every Medical Monday about drinking water. Every single day, if you choose not to drink water, you're taken away from your life. If you're drinking your water like you're supposed to, the way that I teach about all the time, then you're making a conscious decision, number one, to do it, and actually do it. Then it adds to your life. Those are the decisions and choices that I'm talking about. Let's say, for instance, you are on a pharmaceutical drug to manage your blood pressure, or or to manage blood pressure, or to manage diabetes, or whatever the diagnosis may be. It's up to you whether or not you follow the doctor's instructions and take it or not. So it's either adding to you or taking away. But even in that, if you know what I'm saying to you here on Medical Monday, for every pharmaceutical drug that you put in here depletes the body of something, and then you don't take the time out to call our office or to make an appointment or get a consultation to find out what that depletion is, so it can be supplemented the right way. Because I'm here to tell you, all doctors are not trained in that. They are not. We're just not. So most of the things that I'm sharing with you is based upon me taking extra courses or extra classes or researching things on my own, and not only researching them and sharing it with my patients, but I also benefit from the knowledge that I have in my own life. So a lot of things that I share with you guys is based upon my own testimonials. Like I tell you, the bedtime belly buster. When I tell you about Ionox, to keep your cortisol levels low, because my cortisol levels were off the chart. And it was causing me to have that truncal obesity. It was causing me to lose hair. It was causing me to lose sleep. And all those things have been corrected because once I find out something, I do it myself and then I share it with you guys. So I'm saying all of this to say to you that you need to take care of you so you can be the best one that you could be. Hey, Cassandra Flinchoy, thank you for joining on. Please like, invite, and share. So I want you all to know that again, I want to give you my telephone number. If our telephone number, because we're winding down here. I'm managing owner of Bethesda Holistic Center and Everything New, which are alternative and concierge services. What is concierge services? Concierge services is alternative practices that we allow you to take advantage of. Also, that you have personal direct access to me. That's the concierge services, which consists of a monthly fee that you pay every month that allows you to have personal access to me. Because a lot of people walk up to me all the time, Dr. Grace, I have this situation, Dr. Grace, I have that situation, or whatever the case may be. You will have personal access to me based upon that monthly fee to get those questions answered, for me to come up with a plan to help you to be the best person that you can be in regards to your health. And that also includes the health mapping and give you discounts on the products and services that we provide through the concierge services that we provide. Okay, most insurance companies do not pay for that. You can call your insurance company 1-800 number on the back of the card and ask them, do you cover any alternative medicine services or natural medicine services? And most oftentimes the answer will be no. So then you need to be responsible for that if that's something that you want to do. We can't provide that service for free because it's my knowledge base, it's my profession, it's my career, and that's how I make a living. So, but the other things that we can do, because I believe things can work synergistically or work together for the benefit of your good, in regards to your insurances and things of that nature, we might be able to offset some costs by going by what government regulates, insurance regulates, mandates in regards to what we can charge for, being the allopathic side, which is the traditional medicine side. And then we and make sure that your insurance be able to cover that portion if it's an insurance that we take. We don't take all insurances. We take most, but not all. But to be honest with you, most concierge services, alternative health, natural medicines, is a cash based fee service. So, Bethesda Holistic Center, our telephone number is 248-356-1111, 248-356-1111. Our website is www.bw-center.com. You can go on our website and click on peruse through our website. I'm available for speaking engagements. There's a product button to see what products we provide. There is a button for to find out what kind of other services that we provide. We provide a whole myriad of natural services. One of my favorites, and I did a whole show on that, is platelet replacement therapy, or what they call plasma replacement therapy. It's good for restoring hair loss. It's good for wherever you put it in the joints, for the joints to be to help your body to be in a place where it can rejuvenate and restore itself. You draw the blood, you take the platelets out, and you put it back in the body. We do that for hair, and we do that for joints, and we do that for pain management as well. We have this beautiful, beautiful product now that is made with 12 plants. If you're someone under the sound of my voice who is tired of the narcotics, tired of them opiates, we do have what we call natural infusions for us to be able to help you manage your pain and when you off the medication all at the same time, but also manage your pain with natural therapy, which are infusions. We also provide what we call micronutrient testing. I talk about this almost every show, where we actually find out what your vitamins levels are, your antioxidant levels are, your immunodex, what your immune levels are. We're able to tell you to the milligram dose what we need to supplement you with, and we're also to tell you what foods you need to incorporate to make that correction. And after we do that, that is part of the health mapping. And so we'll find out where you are now, and then we can come up with a plan, a strategic, detailed plan that's tailor made specifically for you. Because whatever one person's deficiencies may not be another person's deficiencies. So it's not like you come in and tell me what all these symptoms that you're having, and then I write a script and say, here you go, and you're on your way. We actually get to the root cause of why a person may be suffering for certain signs and symptoms. Thank you for taking time out for this. Oh, no problem, Dion. Thank you. Please like, invite, and share as you guys come on. So please reach out to us. Be active in your life. Be active in your health. Be active, because prosperity is not always about the money. It's about you having a good health to enjoy the money, to enjoy your life. How about that? I know some people that are wealthy and their health is not where they want it to be, and they wish they had their health. You know, money can help, but you don't want to wait until you get to a place where you definitely need a miracle. Okay, not saying God is not in a miracle business. He is, but why wait until you need a miracle? What are you waiting for? Are you waiting for what are you waiting for? For something to happen to where you're going to need a miracle? Don't get to that point. Be proactive now. Take care of you right now, wherever you may be in your health. You may be saying, I'm fine, nothing is going on with me. Still do what you need to do to maintain that. How about that? Health mapping is also to say this is where you are, and if you're doing well and you're doing great, we come up with a plan for you for maintenance for you to get there. For those of you under the sound of my voice who need weight wellness to release the weight, I hear people all the time that they want to become a certain number in their weight for weight wellness. Once you reach that goal, what do you do to maintain it? That is the main key where people do the yo-yo dieting. They never have a plan to maintain once they reach their goal. And we at Bethesda Holistic Center will help you come up with that maintenance plan. It's a lifestyle change. It's just not a diet. I hate that word. If you notice, I talk about weight releasing. I talk about weight wellness. It's a lifestyle change. It's not a diet. It's not an easy fix, okay? So please, yes, we do. We do hormonal testing as well, which is saliva testing. Depending on what reading that you have, your glands in your body is what secrete the hormones. So that's your endocrine system. You have a hypothalamus, you have a thyroid gland, parathyroid glands, you have your ovaries, your testes, your pancreas. All of those are considered endocrine organs. And so they secrete chemicals into the body, and that's in the blood. So some people say the blood system is more accurate. Some people say the saliva is more accurate, because your saliva glands are also part of your endocrine system, which doesn't and your lymphatics, that doesn't how can I say this? I don't want to use a whole bunch of medical jargon. The saliva is more accurate because the hormone levels that are in the saliva didn't have to go through the blood system to be tested. So the route is more direct. So a lot of people say it's more accurate. Then we have neurotransmitter testing. What is that? Okay, these are neurotransmitters. These are chemicals or levels that your nervous system secretes. A lot of people need to have those levels checked if they have problems with even hormones with mental clarity, if they become cloudy, if they have tremors, if they have seizures, if there's a diagnosis of fibromyalgia, if there's a diagnosis of unexplained pain, gone through so many tests and can't figure it out, These tests is something that I highly recommend people get done and have done. Does your insurance company cover them? If they did, it would be something that your traditional doctor would be willing to have done and bill your insurance company for. So this is also what we call another alternative service. And if that's something that you're interested in, again, call us at 248 356 1111, 248 356 1111, or go to www.bw-center.com. That's www.bw-center.com. I think our time is up. I really appreciate you guys tuning in. So my question, oh, it's 8:55. Please, it says, I need to be proactive, just too lazy. Everything you ever said is the truth. Okay, Carl. But you know what? At least you being honest with yourself. That's a start. That is so start. Why are you lazy? You know, a lot of people beat up on themselves about being lazy. Is it a mindset thing, or is it actually your chemistries in your body are so off to where you don't have the motivation to do anything? So that could be it. A lot of people beat up on themselves, saying that they're lazy or they're or whatever the case may be. But you probably might have a chemical imbalance which promotes laziness, be it depression, or not saying that's what you have, but depression, a lack of motivation, lack of drive, all of that, and it can be a chemical imbalance that your body has that it has itself, or it can be pharmaceutical induced. Means the medication that you on can make you feel tired, sluggish, and lazy. So yeah, you probably need to get with me. Hey Phyllis, thank you for joining on. Oh, thank you, Phyllis. I appreciate you joining on. I really do. Thank you, thank you, thank you. Maria Larry Carl, you are not the only one. Oh my goodness. So I need to start a support group called let me see, NML, No More Laziness. That would be the name of the support group. I had to learn to be proactive myself. Yes, Doris, maybe I need to have you come on the show to explain what you had to do not to be that way. Depression, okay, Carl. So that means that your endorphins are low. And then the products that I recommend help promote and stimulate endorphins. But I do highly recommend that you possibly need to have the hormonal testing done or the neurotransmitter testing done. That's collected through the urine. That's pretty cost effective. And then I can see where the endorphin levels are and then put you on supplements to balance all of that out. So then you won't be depressed. Okay. We need more doctors like it. Oh, thank you, Miss Mazine. Thank you so much. I'm going to, Dion says, I am going to schedule testing at your office. Hey, Denise Monroe, thank you for joining on. Yes, Dion, let's do that. Let's get you scheduled for that. Okay, for those of you that are under the sound of my voice that do have Medicare, the vitamin testing is a $1,500 test. Listen to this, but the company that I use have worked out a program for people that have Medicare, and there's a copay. And so there's a copay that you pay, and we charge a small processing fee because we have to draw the blood. Not only do we have to draw the blood, we have to package it up, ship it out, and all of that. So we can't just not do it for free. But the amount that we charge for the copay and the processing fee is not even 1% of $1,500. So you can just redirect your finances and have that done. It's very, very important that you get that done, and you get tests that your traditional doctor don't do. Like I said, vitamin A. We do vitamin A, D, E, K. We do all the B vitamins. We do, like I said, your antioxidants, your amino acids. It does amino acids. Who of you have ever had at your traditional doctor your amino acids done? And then after you got your testing done, we can tell you what your immune system doing and what your antioxidants are doing. A traditional testing does not allow us to do that. So I really appreciate you guys. It is 8:59. Please share this video. Please, can you do that? And you know, sharing is caring. So please share this video with your friends, your family, someone that you think that can utilize our services, someone who has tried everything and nothing is working, or somebody who is not motivated to do something. Hopefully, you will get motivated to love yourself enough to love yourself out of the depression. I decree and declare those of you that are under the sound of my voice, that you'll be healed and delivered and set free from depression, because that is a spirit of heaviness. And God said He has given us a garment of praise for the spirit of heaviness. Spirit of heaviness is depression. So focus on what you have and what God has blessed you with and thank Him for it, which is a form of praise. And He promised that by you doing that, it will shift the environment, but it will also shift things internally for those hormones or those chemicals to be shifted, for you to be in release endorphins, for you to be motivated and not depressed. Because I'm here to tell you, true story. I'm gonna leave you with the story, and then I gotta go. I had this one young lady that she went to so many doctors. No one could tell what was going on with her. She had these testing done, and everything that she was complaining of, when we send the testing over, everything that she was complaining of showed up in her urine, the neurotransmitters. So as a man thinketh, so is he, and it can be shown in a pee. So as a man thinketh, so is he. So whatever you constantly thinking about, it shifts the brain cells and the body to release the chemicals for your body to emit whatever you're thinking, or to line up to whatever you're thinking. So if you're having negative thoughts, woe is me, all of this all the time, your body shifts to that, release the chemicals in the body for the body to emit that, and it opens the door for disease. That's why it's so important that I talked about this, changing your mindset, thinking positive as much as possible, so you will trigger those thoughts to release the chemicals in the body, so your body can line up with the positivity for it to maintain its health, and to also to promote healing. But anyway, thank you so much for tuning in. And I'm Dr. Grace Patterson, managing owner of Bethesda Holistic Center. Thank you for tuning in. Grace and peace. Bye for now. Please get your bedtime belly buster bundle. I will definitely post a link for that. And you need to do what you need to do to redirect your dollars into what you want to see in regards to your health. So I'm not asking you to spend money that you don't have or extra money, but redirect those dollars that you know that you're spending on things that you should not, on things that you should, to be the best you that you can be. What are you waiting for? Grace and peace. God bless. Bye for now.